All right, good afternoon. Welcome to the Iowa Community of Practice. My name is Jessica Craho with the Iowa Coalition for Integration and Employment and a member of Iowa's Employment First Leadership Team. Welcome to April's Community of Practice. Really excited about today's topic and our presenter. A couple of housekeeping things. We'll be recording today's meeting and we'll be sure to share the recording and any materials out to the mailing list afterwards. Captions are available for today's presentation. Thank you to the Center for Inclusive Design and Innovation with Georgia Institute of Technology for captioning for us today and throughout the year. If you are not on the mailing list, I know you're here today, but if you're not on the mailing list and would like to be or need to add a team member, please just shoot us an email at the Iowa Coalition and we'll get folks added. And so I think without further ado, I'm going to hand it over to Brandy McComber, the program manager at IVRS for the DIF project. Thanks, Brandy, so much for joining us today. Brandy's going to give us an overview on what the DIF grant project is and what's going on in the work and what you can expect going forward. So thanks again, Brandy, and I'll hand it over to you. It's all yours.
Thanks, Jess. And I just want to say thank you for having me today, both to Jess and just IT and the entire team in general. I appreciate the opportunity to talk about the grant. We're really excited about the grant. And now that we've gotten a lot of the kind of the behind the scenes things started, we can really get to the actual work of accomplishing those objectives that we're looking forward to accomplishing. So today I want to start out by showing you a video. I apologize if this is not a video that you're able to view for a variety of reasons, but I will specify that after the video, we'll be walking through a PowerPoint that will really go through the same information. So Jess, if you could play that would be great. Thank you, Jess. So one thing I will preface that is that's, a very quick video. So if you didn't catch all of it, not to worry, we will be sharing more information on each of those objectives within the PowerPoint. So if you just want to go to the next slide for that. Thank you. So the first one, one previous. So in terms of a DIF grant, like what is that? And I know that that's something that's a little bit confusing for individuals. And so I just wanted to touch on that briefly. And essentially what a DIF grant is the Disability Innovation Fund. And this is a fund or a pot of money that really comes from monies that are given back to RSA or the Rehabilitation Services Administration. So they give those monies back, states do, for a variety of reasons. It might be that they weren't able to draw down a match in those funds from the federal government or the state, if they didn't have enough money at the state level. So for whatever reason, this money goes back. And what the federal government wanted to do is rather than to just say, well, we'll take this back, they wanted to create a opportunity on an annual basis for it could be our state agencies or it could be other entities to really have the ability to do something innovative. So the purpose of disability innovation funds or grants is to support initiate activities or innovative activities that will be aimed at improving the outcomes for individuals with disabilities. This could be a variety of topics from, developing career pathways to a new one is focused on the pre-employment transition services. Our grant is really focused on those individuals who are either considering or what they call contemplating sub-minimum wage, or they're currently actively working towards that, or they're involved in it, and really helping the system as a whole to move from that idea or philosophy of sub-minimum wage towards competitive integrated employment. So that's really the goal with this grant. It's a 5-year grant. And if you want to go to the next slide, Jess, there are a variety of states that will be involved in it. So listed here are those grantees or states that will be working on their different projects. And part of applying for this is really about these states agreeing to provide materials at the end of that 5-year process, or maybe even sooner, so that all the other states can replicate that work, so that it's not just a handful of states, but that, across the nation, this can be accomplished. And I will say in this as well, recently, there's actual legislation at the national level to remove sub-minimum wage altogether. So this project is really being viewed very closely and monitored for success, because what's happening is they want to use some of the things that all of these states come up with to replicate that across the nation for those states that maybe didn't apply yet are going to be faced with a situation that there will no longer be that sub-minimum wage, and they're going to have that shift as well. So we work with these states as well to kind of do a brag and steal of information. On the next slide, it's really about work not being done in a silo. So, in other words, these are all or some of the entities that have either had conversations with VR or were instrumental in the development, like IC was, of the grant, or provided letters of support or intent, or have just reached out. And so there's so many more that, aren't even on there, but those were, some of those individuals that we were able to focus on. And, just a short number of individuals that we are hoping will be involved in the work moving forward to ensure that we're making the right decisions and really impacting the entire state as a whole. So next slide is really the overall goal of our grant, which is called the Iowa Blueprint for Change. And the overall goal is really to advance and improve systems so that Iowans with disabilities have competitive integrated employment opportunities that lead to economic security. So once again, that is really the focus of the intent, I should say, of the money, is to have that focus on moving towards competitive integrated employment. And then even at the state level, with the governor's interest in a future ready Iowa to focus on not just getting a job, but how can we make sure that individuals, especially individuals with disabilities, are secure economically. Next slide. In order to be transparent, we really wanted to share the total funds received for the grant. And once again, this is the funds received over a 5-year period. So that seems like to some maybe not enough to do the work, and to some maybe too much to do the work. And really, it's never enough to really focus on systems change, because there's just so many moving pieces. But we do have different portions of that money going towards all of the necessary components that we are going to have to focus on. And then we do have some funds reserved for maybe some innovative ideas that we can come up with during this work. So, you know, the key with the money was really to say, here's what we know we need to do, and the funds and the staffing and everything we need to do that. But also, we don't know yet what we'll come up with some of this. And as a result, we want to ensure that we have the funds available to be innovative. So now let's go through some of the objectives of the DIF grant. And we wrote 6 of those in. And so the first objective is to establish and engage a coalition of diverse stakeholders to develop, pilot, refine, and implement collaborative systems change models that support Iowans with disabilities who are employed, or once again, that contemplating employment at subminimum wage, to move into competitive integrated employment. That is a mouthful. And really, this first objective is to say, you know, who are those players, who are the entities, the individuals, everyone that's necessary to really do this work. And our goal is to, as the video had said, or had shown, to develop a core and a coalition. And you know that today you're on one of those meetings, and our goal moving forward is to hopefully utilize this forum for this work. Our activities thus far with this particular objective, or initiating some of this work, from October 1st, when we obtained that funding, until now, is contracts. Once again, like I had mentioned in the beginning, is kind of that behind the scenes, not so fun work, is, you know, saying, okay, now we get the money and we have these contracts that we need to get in place in order to ensure we have the right entities to do the work. Because even if the money was awarded to vocational rehabilitation services, the goal is not to work in a silo once again. And we are absolutely certain that it takes everyone in the state to accomplish this, not just one agency. So we have 3 contracts that are the primary contracts for this work. One of them, which is a required component, is with the University of Iowa, who is what we call a local evaluator. And that evaluation team is taking a look at everything that we're doing and doing some baseline data gathering. And then that, you know, it really helps us to report out on what we're doing and also to replicate what we're doing. The next contract that we have is with Griffin Hammis Associates, and they are absolutely instrumental in what we're doing as well, from their work with the customized employment, as well as providing us with our competitive integrated employment blueprint that we're hoping to present to the core and coalition teams. And then the third contract that we have is with USAID, and USAID is really focused on kind of all that other stuff, right? So they're considered a backbone agency. And with USAID, what they're hoping to do is provide some subcontracting, and our goal, or our hope moving forward, is to do that with IC, so that IC can be instrumental in continuing the work that they've already started. So all of that is tying into preparing us for objective 1, which is finally then getting to the kind of the meat of, here are the individuals that need to at least start this work. And we recognize that there may need to be some changes in that. And in other words, maybe there aren't some players at the table that need to do this work. So really, our goal for the next couple of quarters, and just if you're not aware, at a federal level, the quarters run starting October 1st and on all the way through September 30th. So when I say the next couple of quarters, I'm meaning the April 1st through September 30th kind of range. And our goal with this objective is to get that any contracting in place. And if we're able to move forward with IC, we then, implementing some meetings to start the work. Our hope is to have a coalition that is not only meeting together to provide information and receive information, but also then is dividing out into some different really, really important work groups or reaching out to those entities that need to do this work. So for instance, we're interested in having, and we'll talk about this in future objectives because this one really ties in with all the others, but we're hoping to have a transition work group that combines the right individuals to really tie into what the Department of Education is doing for individuals with their differentiated accountability. And we also want to, as I'll talk about a little bit later, focus on some of the different policies that need to be implemented to ensure that employment first occurs and technology first, and we'll get into that. But what our intent is with this objective is really to get that core and coalition up and running, and then to develop that systems change model as well. And so we're utilizing some different models, and we also want to focus on a blueprint that helps us to define what has to happen at the local level, at the state level, and then systemically, what can any entities do that are involved to make this change happen that the coalition is really driving. So that's kind of what we're doing, focused on this. And like I said, we have not implemented the actual core and coalition yet. Before that, and we're in communication with all those other states that were awarded, and everyone seems to be moving at the same pace and trying to get all of those contracts and all that background information, cooperative agreements, paperwork done so that we can get moving for the next 6-month period. So that is what we're doing with objective 1. Next slide, objective 2 is to utilize the U.S. Department of Labor's recognized direct support professional registered apprenticeship and pre-apprenticeship programs as a model to recruit, train, and retain interested Iowans with disabilities into competitive integrated employment, or CIE. So as it mentions, that this one is really all about those apprenticeships. And, nationally, apprenticeships have really been kind of expanding substantially over the last few years. And I think in part that is because they're being identified as a really beneficial mechanism, both for the apprentice themselves as well as the employer. And for employers, apprenticeships are able to help that employer to assist in the training and experience necessary to train individuals so that they are prepared for that workforce. And with direct support professionals, what we're hearing from our CRP partners that we value is that there is just this loss of individuals that are interested in the profession or that are trained, or just a severe shortage of those professionals. And so we're hoping to fill in some of that gap. And we're hoping to utilize this not only with CRPs, but schools and other entities as well. So the focus here is all about those apprenticeships. And obviously there's benefits for that apprentice as well, such as a recognized credential and the training and the classroom instruction that is in need to understand the components of that position, as well as to build a career ladder for the individual. So in order to initiate this objective, once again, as I mentioned, that objective 1 really ties in. So we do want to create another work group that will have entities such as Iowa Workforce Development, individuals from the Department of Education, and any interested individuals to really focus on how do we become an intermediary for this? How do we recruit for this? How do we do the training and the retaining? What steps do we need to take to begin? So once again, this is not an objective that we planned on initiating the first 6 months, because that's that background piece, but we want to hit the ground running over the next 6 months to get that work group up and running. And these work groups will really drive the decisions that are made in how this should look, because we want to have this very much be a learning process, as it relates to the work, because we are absolutely not the experts in this, and individuals who would undergo this, CRPs, schools, people with disabilities, parents, whoever it might be, are those individuals that would have the expertise. So we want to make sure that we're involving them. And that's really what we'll be focusing on in this next 6-month period, is getting that up and running. For objective 3, the next objective, it's about increasing that ongoing delivery of the preparation, placement, and support services beginning in the early high school years and resulting in uninterrupted and really a smooth transition to competitive integrated employment for youth with disabilities. And what we're wanting to do with that is, once again, focus on and align with what the Department of Education is doing to outline the different school districts that are in maybe need of more support for that secondary transition, and align that with different supports for individuals with disabilities. So Kirsten with the Department of Education did a wonderful job of presenting to our internal staff at Vocational Rehabilitation to really update them on what's going on and what the next steps are. And then with the DIF grant, we're really wanting to tie into that group that's already been there to understand what they're doing, but also bring this to that coalition and see what other stakeholders, individuals we need to have immersed with that to make decisions on what's best to move forward, to make sure that competitive integrated employment is that first and not the last option for our youth. Because, in some areas, those youth are still kind of being either targeted or filtered through some different maybe habilitation and maybe sheltered work and sub-minimum wage work. And we really want to train anyone that's necessary within the state to understand that competitive integrated employment is so beneficial as the first option and not the last option. So this objective is really about a variety of things, is making sure that we're developing toolkits and resources that can be provided. We want to partner with GHA, who will be establishing, or Griffin and Hammes, I should say, that will be implementing an Everyone Can Work curriculum. If we can get that up and running, that would be followed by some live facilitated discussions, as well as that development of the information and resources for outreach to students and parents and guardians, and a toolkit, once again, to help really understand what kind of method would work best. Part of this, as well, as we want to establish 6 pilot project sites, and we're hoping to align these sites with those schools that have been identified by the Department of Education as most in need of secondary transition, because where there's a need for secondary transition, obviously there's most likely a more dire need for those individuals with disabilities within the department as well, or within that area. So there will be a lot of different outreach to individuals, and what we learn from these pilot projects, we're hoping to utilize as a kind of an approach that others can take for individuals with the most significant disabilities, especially. We're also hoping to include the schools in our what we call the ACRE recruitment process. And that's something that the Griffin and Hammes is once again providing through their contract, is this training that's really focused on making sure that individuals have the right supports and training necessary to work with individuals with disabilities. So we want to actively promote as well the inclusion of transitioning students with those most significant disabilities into the pool of employment seekers for the providers receiving our mentoring that will happen with Griffin and Hammes as well. So, a lot of different things that will be happening, and once again, stemming from hopefully the coalition and any interested parties who want to be a part of that transition work. Objective 4 is next, and that is to facilitate an increase in Iowans with disabilities with obtaining and maintaining competitive integrated employment that leads to economic security. And I mentioned that everyone can work curriculum that we want to move forward with Griffin and Hammis. And so we're not only hoping to provide that to youth and parents, but also to providers who currently hold what we call 14C certificates, or in other words, that's a certificate that currently allows the entity to provide a payment of some minimum wage to the employees. So we want to include and really target 14C providers in our ACRE recruitment efforts, as well as provide training and technical assistance on how you can move from a model of 14C certificates and some minimum wage to competitive integrated employment. And for our CRP partners, we understand that that's sometimes ingrained in a business model, and it's going to take some assistance and discussion for those that are interested as a provider to understand how that can move forward. And that might mean some different discussions held between those funders of different programs, for individuals, like vocational rehabilitation, communicating with different providers and funders to determine what can be done to make sure that things are streamlined and everyone is on the same page. So I've mentioned Griffin and Hammis multiple times, and I know Jess is probably a better person than I to talk about what, is happening at that level. But, with that work, we have really hit the ground running with Griffin and Hammis on what they're doing related to customized employment and how that's been new and improved through the DIF grant. So we have officially recruited our mentoring participants, our 10 employment specialists from a pool this year of already existing customized employment specialists for year one. And this will be not only more intensive services, but really a more intensive ability to receive that technical assistance and training that will assist these employment specialists in actually reaching fidelity in the services that they're providing. So it's a phenomenal project, and you'll see great things from that, and that has already begun and has been underway. So we will get started in these next 6 months, or the quarter 3 and 4, on really actually trying to bring in individuals with disabilities who are job candidates from vocational rehabilitation to work with these employment specialists, from a variety of places as to where they're at in their process of the rehabilitation plan. Also included in this objective is really a focus on self-employment and entrepreneurship. So internally, Voc Rehab has a self-employment program that we promote as an option for our job candidates. And so we will be kind of enhancing and promoting some of that work as well. And then we're also considering some different training courses that are available from other entities, such as Griffin and Hammis, that are available on this topic that we could use as a toolkit or a resource to give other ideas for individuals with the most significant disabilities who want maybe their own schedule and maybe their own customized different kind of employment setting where they're their own boss rather than just obtaining work in another setting. So that, a lot of activities will be happening there, hopefully also focused through that coalition and core team work of developing some work groups on what do these services look like and what's needed. And through a variety of these objectives, we also want to focus on those tough needs of individuals with disabilities, like wraparound services, like things like transportation. And through this grant, we have a unique opportunity to have some funds available to really be creative and innovative in maybe bringing in experts that have the knowledge that can help guide, or paying for items that maybe would really help initiate some of this work. So there's a variety of things that we want the coalition to come up with in terms of innovation in that perspective. The next objective, objective 5, is to increase expectation and demand for customized employment, for competitive integrated employment. Too many acronyms. Competitive integrated employment for all Iowans with disabilities. So with this objective, you've heard me say it's like a broken record. Once again, we really will rely on our core and coalition team, anyone that's interested in work on this. But this objective is really about gathering the resources and providing education to really the state as a whole, whether that's stakeholders, individuals with disabilities, whoever it might be, and promoting activities such as we will be having, excuse me, a community of practice that really addresses not only the activities of this grant, like providing the updates that I'm providing today, but also promoting competitive integrated employment as the primary desired outcome. We want to, as I mentioned, develop toolkits that will help individuals with disabilities, their families, and those entities that are helping them to really articulate that demand for CIE and advocate at the individual level for, for changes. And then, at the state level as well, focusing on funding and policy changes. So, a number of initiatives that will occur there, but all stemming on, not only trying to come up with what these would look like and relying on the experts to do that, but also to make sure that we have an impact on those things happening. And then the last objective, objective 6, is the aligning of public policies, funding, and practices that support CIE as the first outcome and the preferred outcome. So we want to really have, I know we've done, and if you've been on this coalition, the state of Iowa has had that employment first focus for a number of years now. So that's nothing new. But what we don't have, and what a number of states do have, is an actual employment first policy. And so that's something that we want to focus on implementing for the state. And what that will do for us is really outline the fact that we, are serious about employment first, but also it allows a mechanism to say that anyone with a stake in that employment game really should be considering competitive integrated employment first and not last. And really that having that philosophy of anyone can work in competitive integrated employment when provided with those right supports. So we'll focus on work groups that will help with that policy development. And because there are a number of groups like that employment first group that would really be wonderful to tie in there. And then the other side of it is a technology first policy. And this is something that Judy with USED had suggested that we focus on as well when we were writing the grant. And that's really, there's a number of things that are involved in that, but we want to make sure that technology is, number one, utilized as a first and not a last option. I think one thing that COVID taught us is that, if we have everything in place as supports, technology can bring us together in so many ways, but also, focusing on individuals with disabilities and the idea that, individuals can receive some different services with assistive technology and other supports out there that could benefit them. So some of those activities will be happening under this objective in the upcoming months and quarters. And so those policies are a part of it. And, it's really, really focused on those individuals with the most significant disabilities and making sure that we're also collaborating with the appropriate entities to ensure that our payment structures and our policies are in alignment. Because if that does not occur, then we're really kind of stuck where we're at. The other piece of this is to look at the internal structure within vocational rehabilitation services. We have tried to be innovative in different areas such as transition by building what you could call a tiered level of support. In other words, we have support internally at that state level that can help external partners all the way down to the local level where we have the individuals out there doing that important work of working with people with disabilities. So, what we're focused on for this project is developing that same kind of tiered level of support for working with people with the most significant disabilities. So my position currently was created as a result of our grant. And even after the grant, that 5-year period ends, the position will really focus on how do we keep these things going rather than just say, well, the money is done. So over the next 5 years, my role will be to not only oversee all of these different things, but make sure that we're able to sustain them, whether it's internally or externally, and how that needs to work. And so then we also have Vienna, who I believe is on today, and she is our CRP resource manager, and she is absolutely instrumental in a lot of the different things that you hear here. And, she has a number of those initiatives on her plate. And then, that's just so much work. So we need to develop some additional positions. And so we're looking at in the next few months, hopefully posting 2 counselor specialist positions that will focus solely on the work of this grant. And then once again, after it ends, focus on the population and providing internal training for our staff so that they feel that they have supports at the local level to implement the DIF grant work and then sustain that work and just be a resource for those field staff that need more support in this area. So we're looking at that internally as well, so that not just saying, well, everything else needs to change, but how can vocational rehabilitation be innovative and change as well to ensure that we're providing the best services for the most significantly disabled population that we work with. Jess, if you want to go to the next slide, thank you. And as I mentioned, there are 3 contracts doing this work. There are a variety of other smaller contracts that could occur, but these are the first ones that we are working on, and that is the University of Iowa, Griffin-Hammis, and USAID. So that has comprised our initial leadership team to really kind of start to organize the things that need to happen in order to accomplish these tasks. So many meetings and hours spent on these activities behind the scenes that we will utilize in order to be able to hit the ground running. So I just wanted to once again remind you of those entities. And other than that, if you go to the next slide, I just wanted to talk about a little bit about the budget, because, at the beginning, I told you we had this pot of money and what are we going to do with that? So, with this large of a grant, budgets are very complex. So what I tried to do is kind of pull in some of the pieces from different subcontracts and contracts to help you understand a little bit about what we're doing. So first and foremost, we want to make sure we have a budget for project participant supports. So those would be any of the supports that maybe an individual who's considering sub-minimum wage or is working in sub-minimum wage, and we're bringing them into the vocational rehabilitation program, and they need a support that's maybe not covered by another entity or source. We want to make sure that we have funds available to be, once again, innovative and provide those supports. The next one is equipment and assistive technology. So there's a variety of things that we will need for individuals at a variety of levels. So that could be one example of this is if we focus on things like virtual job coaching. Are there iPads or other devices that are needed? So assistive technology, are there laptops and software that are necessary for the staff that'll be working in this and the staff that are providing services to individuals with disabilities? So looking at all the equipment and assistive technology needs for providers, for staff, for job candidates. Pilot costs. So I've mentioned some different pilots, we're working on, and I guess I didn't even mention our IPS work, and that was silly of me to leave that out. So one of the things that Vienna is also spearheading, in addition to the customized employment, is the IPS work for those individuals with mental health disabilities. And so, we have that more intensive pilot project up and running too, or initiating, and it will be going up and running. And we've even implemented some internal support groups for our staff to ensure that they have the resources they need for that work. So we have those pilot projects, the IPS, the customized employment, as well as the 6 pilot projects in the transition realm that we're hoping to get running here shortly. So, with pilot projects, there are always costs associated with those. So whether this is an expansion of a program, whether it's working on a CRP that has 14C programming now that wants to transform out of that role, and they need funding to do so. And things like our apprenticeship programs, all those different pilots that we're having run, the costs associated with that are built in as well. Training and professional development is another one, and that's anything from training for the staff on what they need to do to training for the professionals that are involved. I mentioned things like those curriculums that we are able to provide to providers and parents and youth and all of that. So all of that is tied into some different training budgets. Travel and supplies. These things could be anywhere from office supplies to print materials for individuals, all the way to travel to get out there to the project sites and make things happen, to different places where we need to promote based on the requirements of the grant, the activities that we're engaging in. And then staff and contracting costs as well. So I mentioned the 2 positions within VR. I also mentioned some different contracting, and those are all costs associated because we need staff to do that work. So that is the other budget item that is a pot of money that we have built in. Other than that really, if you go to the next slide, I believe that concludes, the overall thoughts, objectives, and goals of the grant. I don't know if anyone has any questions. Jess, do we have any time for that?
Absolutely, yes. Yes, either unmute or throw your questions in the chat.
And I will preface it to say, I understand that is a lot of information and it's coming to you for the first time for some of you. So if you need some time to process that as well, we're always happy to take questions later, but yeah, jump in with anything that you have questions on.
Whoops, Brandy, this is Kirsten. That was a great review. And I think most of us have heard a lot of that, kind of the plans. And what I'm wondering is, at what point will we start to do like some of the like, I know you talked about all the background and stuff that needs to happen to get positions in place and all of that.
Right.
Do we know, like, when will positions be in place and when will we be starting the actual work of I know the work that you're doing now is the work of the grant, getting it set up, but with actual, where it starts to impact people.
Absolutely. Great question. So in terms of internal positions, and some external, we have everyone in place from our University of Iowa and our Griffin and Hammis contracts. We do have a couple of coordinator positions through the USED contract that will need to be in place. We were hoping to have those in place now, but we want to make sure that in the next 2 weeks, I believe, we're meeting together, USED and I, to finalize those job descriptions, and then we want to hit the ground running with that. So my hope is in the next, so Q3 and Q4, so this next 6-month period, but I hope Q3, so the next 3-month period, we will have those positions posted. For the internal positions within VR, we originally projected February, but due to lack of the FTEs, is what we call them, or those full-time employee positions, we were unable to achieve that. So the latest update that I've received internally from our administrator is that his hope is that by around the May area, we'll have those posted. So those positions are the ones that, obviously are a piece of it, but we're moving forward whether we have those or not. So, in terms of when will this be happening? So part of our first reporting to RSA, which is once again that federal governing body, is to update what we call our work plan. Now that we have all of these like behind the scenes things done, when are we looking at projecting the others? What we are hoping to do to implement the core and coalition is to get that subcontract or mini contract in place within the next quarter. That would be my goal. So within this next quarter, we want to have that in place. And so if you remember when I talked about the core and coalition is what we want to use as our framework to start this work with the transition and start this work with the apprenticeships. We need those, we need that contract in place because, you know, if we're not paying anyone to do that work, it makes it impossible. So what we need to do for that is a couple of internal meetings and an external meeting to make sure that those entities that we're hoping to partner with want to partner with us. If that were to fall through, then what we would do is through USAID, they'd immediately send out a kind of a call for participants to start on our own. What we don't want, the reason we don't want to do that is this group has been phenomenal in, I mean, all the players are in place, right? So we'd be reinventing the wheel and we don't want that. That is silly. So we're hoping to get that in place as soon as possible. In terms of the work on the work plan, so with this work plan that we're developing, we have to provide the first year's work, and the first year is the next 6 months. So as a team, and that team is currently the individuals that have the contracts in place, and we're developing that work plan as to what can we accomplish for the remaining 6 months of this period. So what that would be is first implementing the core and coalition work. Like I said, I want that done in the next 3 months if possible, but I understand that there sometimes, you know, due to scheduling conflicts that may occur Q4, which would be that July range. So within that range, we also are cognizant of with transition. If we want to jump on to the differentiated accountability, that, you know, that is up and running, and we need to make sure we get going on that. So that would be our first call under the coalition for entities that want to have a work group, because we have to be aware that if there is a group out there doing that work, we can't just take over their meeting time if they have other objectives. So it will be an invitation to, you know, those individuals as well as others through the coalition. So my first goal with the coalition is to get that transition group up and running. And so, you know, it's hard to say right now. We have a deadline of May 1st to get our work plan to RSA, and then they have to approve it. Right now, we have another meeting to finalize that. But once again, the first thing in this next 6 months, we want to get all of the work groups that we talked about up and running. We want those to occur. So that would be our next step. And what we're hoping, I mean, within the next 3 to 6 month range, you should be able to see information that is occurring and that we're asking for individuals to participate in those groups.
So work groups and those 4 positions.
Absolutely. Right. Yeah. So it should be a busy, excuse me, a busy few months.
Right.
Yeah.
Okay.
Yep.
All right. Thanks.
There was a question from Mari. Brandy, what kind of data will you be required to report?
Oh, great question. With any federal grant, there is a lot of data that we have to report on. So we have what's called a project status chart. Our project status chart is I believe a 25-page document that lists out the performance, program, and project measures that we need to be cognizant of. So that is the first area that we have that we're required to provide data. And so within that, there's a number of different requirements that came from RSA that we have to be aware of. And then there's a number of requirements that we implemented that we want to see. There's other data that we'll be reporting through our local evaluator, excuse me, which is once again that University of Iowa. So they're doing a number of pieces such as baseline data where they're interviewing all of the key implementation partners and implementing what kind of where their baseline is. And then later, you know, looking into that, they're going to be engaging in some focus groups that will gather data. So there's a number of pieces that they'll be providing that will help inform the core and coalition team in their work. So part of that is those presentations to those groups on what is happening with the local evaluator. Excuse me, in terms of our project status chart, I can share kind of, and I don't want to waste the rest of your time going into some of the details, but is it okay if I share my screen quick, Jess?
Yeah, let me
Awesome.
just make sure. Make you a co-host. Okay.
Okay, so let me share with you what that looks like, just because sometimes it makes sense to, or it helps put it into perspective. So if you're able to see, are you able to see a document that says the U.S. Department of Education? Awesome. So this is what they call our project status chart. So this is very specific as to make sure that all states are measuring the same data points. We need to develop, a number of markers or methodologies that help us to do this. So there's some that they require. I'm just trying to find a good one here. So for program participants, in other words, that's an individual that's coming into the system, that's working with vocational rehabilitation in terms of having a case open with them, with us, and how they tell us how we will measure that is to identify, for instance, the number of participants at either the time of application with vocational rehabilitation or the development of their employment plan who have worked for an entity holding a 14C certificate in Iowa and then earned less than the federal minimum wage. So, that's just one example, and it goes kind of on and on and on. And so what we're hoping to do is to report out on those numbers as we start to implement the project. Right now, there's a lot of zeros there because, there's no project implementation yet in terms of participants. So that, we have to get these project sites up and running for that to occur. And we're hoping that occurs at the end of this first year into the next year. So that is kind of some of the data that we will be required to report. All of that is required to be reported to our federal government. I did get a direct message that said if I had to give a short summary of what the grant is, what would it be? And it's just so large. So great question. That makes me think a little bit. But what I would say is really a grant that is designed to be innovative to support individuals who are either contemplating sub-minimum wage or engaging in sub-minimum wage to move into competitive integrated employment with the right supports from this program, I would say. That would be, I guess, my focus. Keeping in mind that there's also that systemic level of change that we haven't even really talked about, right? It's not just saying, here's what you need to be successful, because you can't be successful without that systemic level of change. So it's really change in the entire state is what we're looking to develop. I got another question directly, and it was, will there be some compensation for the pilot groups as they're taking a significant amount of time away from their services? And in terms of that, what we've looked at, and that's a great question too, what we've looked at is, are there ways to ensure that those entities that are agreeing to participate in this, because it is a lot of time, right? It's time spent, that they will, we're looking at, will they have a commitment to provide a certain wage to the employment specialists that are going through this program, and as a result of that, can VR pay for the services for the job candidates that are going through the programs a higher level if they're undergoing these pilot projects, so that the CRP can pay the employment specialist a higher level? Because what we've learned is studies have shown that if employment specialists have reached a certain level of pay, they are much more likely to retain or to be retained and to be satisfied in that employment, which really helps continuity for our job candidates. So yes, we are looking into that. Once again, we don't want to make a lot of decisions without this group, if this is the group that we get to select, to do this work, so that they have input in that too. But yes, that is something that we're considering. Absolutely. Jess, I don't know if you got any other questions.
I've got a question. This is Marcia.
Yeah.
does the phrase "someone considering working in sub-minimum wage" by default also mean anyone who has over the last 8 years, 5 years, chosen to go into a day hab as opposed to employment?
That, that is a really, really, really great question, because, when they, as you know, sometimes with the federal government, they give you a term, but they don't give you a definition for that term. And that's kind of a detriment, but it can also be a really good thing too, right? So we get to define that. So how we are looking at that is I don't want to say twofold, because it's kind of multifold. So what we're defining that contemplating is not only individuals who have, maybe vocalized that they're considering this, right? That they want to go into sub-minimum wage, or maybe a school or another entity has vocalized, but absolutely, we are going to consider anyone currently receiving any dehabilitation, adult daycare, any of those types of services as automatically contemplating. So we will be providing outreach to all of those individuals to determine if they have interest in participating with VR, and therefore with our project. And then in addition to that, with youth, we are also trying to open up that to those youth who are coming in or currently have Social Security benefits. So as we receive those individuals who because, under our umbrella and VR is also Disability Determination Services, who makes those determinations for benefits, right? So we receive a list of those individuals who are considered youth, who are coming in and receiving benefits. So outreach will happen to those individuals too. And then because we know that, that doesn't necessarily mean that we're going to reach all, then we are also going to consider it level 3 students at the high schools. Yes, high school. So we want to make sure that we're being as broad as we possibly can, while still making sure that we're staying to the true purpose of the grant. So yes, I hope that answers it.
Okay, at least in the Des Moines area, we're struggling immensely with the reality that families need to have the people that they love to be safe, and employment in the community is considered at risk or a risky thing. To the extent that people have been receiving services from us for several years, sometimes 4 or 5, and then as soon as a day hab opportunity is coming up, they're saying, "Oh, out of here, we've got our 8 to 2:30 situation resolved. We don't need a job." And then the other piece with the employment first model, and I'm assuming that some of the goals tied to number 5 and number 6 would be the long-term support levels for 100% job coaching, and also perhaps even the definition of what job coaching might include, including restroom support, because those are also becoming functional barriers for the folks in the Des Moines area.
Thank you for for sharing that, Marcia. Yes. Part of the requirement under the application when we applied for this grant was that we needed to identify wraparound services support. So how are we going to take a look at that? What does that mean? So we wrote in there that we want to make sure that that was one of our activities under our objectives to, talk about that. Once again, that's going to be some of those work groups that would consist of coalition members, and that very much could consist of individuals working with vocational rehabilitation, if you have any interest, Marcia. So, to really focus on those types of services, because you're absolutely right. And it's not just a Des Moines area issue, it's a national, issue as well. So it's, what are those wraparound services for participants, and how can we bridge that gap? And once again, how can we be innovative? So in terms of job coaching, with VR services, we have our definition of job coaching, as well as additional support, such as those personal assistant services and things like that. But what we're wanting to do in here is, yes, we want to sit down at the table and say, really, what do we need? What needs to happen? Who needs to be responsible for it? Because at the end of the day, even if we pay for it in this grant, and we just, what I don't want to do is just to say, we're going to pay for that right now, because in 5 years, then it's, now who pays for it? So really those deep dive, like what you're talking about, Marcia, of the conversations on how can we be innovative with this, and who needs to come to the table, and what policies need to change, and and when I say policy, not only state level, but as a whole for our state, but what agency policies. So what does VR need to change for that? And what can they change? What could the Health and Human Services, what could the, I'm just making up names, but what could everybody change, and how can we work together? And when I talked about that blueprint that GHA is helping us to develop, to present to the coalition, that is one of those pieces in there, is that systems level change, not as a system as a whole, not only as a systems level as a whole, but for each entity. What does VR need to do as a system to make this happen long-term, to sustain it? So yes, and yes. Okay, so Kelsey, I see about the determinations for the level 1 and level 2 students. So correct, you are absolutely right. So one thing that we have to stay focused on is trying to stay true to the contemplating, and really the contemplating sub-minimum wages. You have an individual with the most significant disability who is kind of steered towards that. And so originally what we had it listed as is those individuals who receive Social Security benefits. And, as we met with Mathematica, who I know this is complex, but we have a local evaluator, and then there's a national evaluator to evaluate all of the states that are doing this and provide report outs on that. But, one of the things when we met with them and they talked about is really, and then when we met with Griffin and Hammis and our other key implementation partners, is this really the population that we want to only focus on? Because that means that if we have a student, for instance, that is on Social Security benefits, then that is really the only mechanism that they'd be able to come in if they're not actively saying that they want, or that they're contemplating the sub-minimum wage. So why we chose level 3 is it tends to be, with the level 3 students, that those are the individuals through that matrix that the school uses as the ones that are reaching the need for those supports and services. But we had to also create a cutoff, because what they won't allow us to do is say, well, anybody with a disability, because we have to have some kind of methodology to track the data. So with the level 3, keep in mind that that is one piece of it, but any individual with a disability that is also pursuing that or contemplating it through another means. For instance, if you have an individual who is saying, or a parent who is saying, we're considering sub-minimum wage, then that automatically will be another mechanism to bring that individual in and focus on that. So it's not like you were saying that those are an all situation where you have to have benefits and this is our definition. It's somebody who has this and or somebody who has this. So we are, we're hoping through that we can reach, if there's a level 2 student, for instance, who's contemplating or who's pursuing sub-minimum wage, they will get in through that pursuing sub-minimum wage instead of just the level 3, if that makes sense. Yes, and the crazy thing is we could probably spend, 3 days together. There's so many pieces of that. And that's why we're hoping that the coalition moving forward will be this entity that we work through these things, and make these decisions. But yeah, that there are a lot of kind of bigger picture things that we have to keep in mind, because we originally thought that there'd be just a few performance measures. And when we received the document that was 20 some pages of them, we have to be cognizant too of what's already defined for us. And so, we have to, it's kind of one of those where you have to keep it straight in your mind that here's where where they've left it broad and we can define it ourselves. And here's where they're saying, no, we defined it for you. So that is kind of one of those areas we got to define a little bit more.
Thank you, Brandy. I don't see any other questions, though we'll remain on here for a couple more minutes as we wrap up. We'll be back in May 11th, Thursday, at 1 p.m. We have yet to determine what we'll be discussing and covering that day, but we'll share that with you as soon as we get that figured out. If you would like to share any ideas, or if there's content that you would like to see, please share that in the chat or shoot me a message. And we can certainly focus on that and try to make that happen. But again, we'll be back in in May on Thursday, the 11th at 1 p.m. I'll be sure to send the recording out, as well as the video link and the slides. Is that okay, Brandy? Perfect.
Absolutely.
Okay, great. So look forward to seeing you in May, and thank you so much for joining us today. Enjoy the rest of the day. Enjoy the lovely weather.